Welcome to ICCG's Close-Up, sponsored by Round World Solutions, where Fortune 1000 CXOs share their enterprise strategies for competing and winning in the global economy. Our wide-ranging topics include big data, governance, supply chain analytics, enterprise mobility, and portfolio management. The goal of our interviews is to understand the CXO's area of focus, the challenges associated with that area, and their plans for confronting those challenges. The benefit to our participants is the creation of a virtual CXO knowledge pool, so CXOs can learn from each other and not have to reinvent the wheel. I'm your host, Ellis Booker. From another person on the call, Steve Winstead, a Round World Solutions partner, is with me, who's going to ask you something about the governance of all that data. Take it away, Steve.
Yes, Rick. Quick question around the data governance is, how are you seeing data quality issues impact your overall data governance strategy?
Yeah, Steve, I think that's a huge and impactful part of our strategy, and certainly would be with any monetization strategy. And it's a problem that we have to partner with the business on, because it's not a completely 100% technical issue. We can't apply technology to that problem completely. So we have to partner with our business customers internally and have them help us develop processes and procedures that will improve data quality. We have to do that also in concert with their own schedules. So again, it's an IS almost led type function, and we're trying to evangelize that that's not necessarily the case. Really, that data quality is an organizational priority and not an IS one, and that part of the conversation is happening, and we need to have that. The other thing that we're doing is, from a technology perspective, implementing a master data management program to try to solve some of that disparate systems issue where we have data in systems that don't talk to each other. So we're doing an MDM programs to put the technology forward to help solve those problems. But the complete answer to your question, Steve, is that it is an issue. It's always going to be an issue, and it needs to be addressed as an organizational priority and not necessarily just an IS one.
Thanks. What are a couple of other key priorities you've got upcoming for the next 12 months?
Well, for this year, really, because our market space is what it is, and we're in the state of making budget adjustments because of that, because of our space. We're looking at trying to be more creative in IS about getting our organization to have more of a foothold in the marketplace. So an example of that is, we call ourselves business-led IT, which means we're not just a support organization where we take help desk calls and so forth. We do those things, obviously. We do KLO, keep the lights on, but we're trying to make ourselves more part of the discussion in terms of the business partnership and saying, look, you can do these three things right here and maybe increase our foothold in these particular parts of the market. So a large part of our objectives, both technically and non-technically this year, are around providing some value back to our business leadership so that we can increase our overall bottom line in the organization.
So, and a lot of that conversation, I'm sure you want to drive around business benefit discussions.
Absolutely.
Yeah.
I wanted to ask first about Leidos's data projects, particularly anything you're doing in the big data arena. Why don't you tell us about some initiatives?
Yeah, great. We're currently taking on a few initiatives. We wouldn't classify them necessarily as big data. Our data is sort of sub-terabyte, but we are taking on a lot of data science type initiatives, certainly because of the way our market's working right now. We're challenged with coming up with new and innovative ways to use information that we have stored over time in order to tell a better story. So we're doing a lot around data science, a lot around predictive modeling. We started that program, but we're going to see it through for the rest of this year. It's going to be a big part of our internal IS value proposition.
One of the things you mentioned to us a couple of days ago was how you're attempting to monetize these data investments. Can you speak to that a bit?
Right. I mean, we're very similar to most medium and large size IS departments, where we're kind of a revenue black hole. A lot of funds go in terms of annual budgeting, and in our case, we need to start thinking about how we turn into a revenue center as opposed to just a black hole for expenditures. So we're again looking at how to monetize some of the intellectual property that we have inside of IS. Some of that is certainly going to be around the mobility development for customer applications, customer portals, and then a large part of that is, we hope, is going to be around the data science piece, around the data analytics piece. We don't know what that strategy is going to be yet. We're still working it out, but it's certainly on the books in terms of what our major initiatives are going to be this year and how we're going to turn IS into a revenue generation model.
Terrific. One question I always wonder about in terms of data projects is the function centralized, or have you distributed sort of data analytics and analysis throughout the organization at the line of business?
Right. Well, yeah. Single data storage is a great idea. It's very difficult to achieve. Most companies, whether you try to do ERP to handle that or other methods, you inevitably end up with disparate systems, and that's almost always, that's very common the case. So what you first have to do is determine, what that data storage profile looks like. Are they all over the place, as you say? Are they internally contained? All of our data is internally contained, although it is on disparate systems that don't necessarily have a communications mechanism between them. So we use other types of techniques to try to help solve those problems.
Casey, thanks so much for joining us today and for the information you've given us so far. Yeah, one of the things, as Ellis had mentioned, around big data, and I wanted to ask you that about big data and analytics, particularly focused around how you see what's happening between the roles between healthcare provider and payer, and how you see those roles sort of working and changing and modifying, especially as regards big data and analytics.
Absolutely. So if we, again, as we look at the broader context and what's happening on the ACO front, which is really the testing grounds for what we're going to see in the future, which is one payment, regardless of provider, and we'll be one happy family instead of everything being parsed out and unbundled. So we'll go back to the way things used to be. So it's very critical in that situation. And again, there's a lot of complexity and sensitivity around the fact that individuals may not want to share information with the payer of that claim. They may. I was at a conference yesterday, and the CMO from Walgreens was talking about the payment model and how kind of what's the interest that they have right now with individuals going and getting treated, whether it's Walmart, Walgreens, or CVS, and the fact that anonymity is a big part of that. So if they want to get tested for some type of STD, they don't want to go to their primary care physician, who they may have known for a long time. So they'll actually go to that care delivery model, so that they don't have, so no one knows that they've, not only that they've been tested, but what those test results are. And so that's a big conundrum as you think about it. But when you look at all the data being shared among payer, among provider, and then all of a sudden you hear about, well, let's see if we can suppress some information because we know we need this at the point of care, but we don't want to share this with the payer who may have a connection to the employer. So we don't want the employer to know about it. So I think that's where things get rather dicey and difficult from a healthcare context. But in terms of big data and the need to improve the health of the population, and in an ACO model, obviously you're looking at chronic conditions in ways that all the caregivers can come together and work with the payer as well. And certainly risk adjustment is a big component of that, as well as the ultimate outcome. So it's all based on value and how well everyone is able to provide care and make sure that the communication is good among all parties, and that ultimately you're able to really move the needle on improving health. And, you know, again, if you don't have good data going into that process, as well as very sophisticated systems, and the systems are just evolving now to really do the really high-end analytics and informatics that really is necessary. And there aren't a lot of people out there that have a lot of the skill set to really move the data and be able to deal with huge systems. And normally,
right, Casey, we are going to ask you in a minute. I'm very curious to ask you about issues that your members, the HEMA members, may have finding talented staff to run these IT systems that are, as you said, evolving very quickly and meeting all these legislative and privacy mandates. But since you talked about security and privacy a good deal just now, is the industry, at least in the United States, pretty well positioned, do you think, to answer those concerns around patient identity and privacy?
well, it's interesting because I think that although there have been some very sizable and well-publicized breaches and things that, you know, have gone awry recently, there's still a feeling and an openness to share information. You know, certainly among the younger population, they're very open about sharing personal information and not thinking all the time about some of the consequences. But I think that there is an element of forgiveness factor, and if you look at some of the recent polls that have been done, in terms of the risk benefit, I think that many consumers of healthcare, you know, understand and recognize that they want to be in the driver's seat, and that's what improving population health is all about: is engaging patients and really holding them accountable for taking care of themselves. Mm-hmm. And many payers are also offering incentives, if, you know, in terms of, you know, quitting smoking, so smoking cessation programs, as well as other ways. You know, I've heard of other health plans too that will even give out Fitbits for free and that type of thing. But as we move towards medical homes and really providing care outside of the four walls of a hospital or an ambulatory clinic, it really is incumbent upon patients to, you know, share their information. It has to be easy, it has to be simple, it has to be rather seamless. So,
right, and as you were talking about the analytics that, say, a hospital or a doctor is using, isn't it the case that patients increasingly want access to the dashboard? They want to see their own, in the case of a Fitbit, they want to see their own dashboard on that. So that's a new layer of complexity that didn't exist a few years ago, I guess, right?
Absolutely. It's really an exciting time for us. And again, there's that balance that we're all seeing in terms of patients really wanting to step up to the plate and try to improve their health and well-being. And if we can, there's a lot of trust that goes into making this model effective. In fact, there was a panel discussion that I heard yesterday and about really how to move the needle, because not only do patients need to trust the system, but also physicians need to trust it as well. So it's not going to do us any good if patients are contributing in terms of, data at the point of care. So patient-generated data that is able to come into a healthcare system, to whatever their medical home is. If the physician isn't going to feel as though they can trust, if it's point of care testing that they're doing, looking at glucose monitoring, and if they have to come into the hospital and then repeat those tests. So we really need to really change the way that we look at things. But certainly I think with patient portals and physician portals, I think we've certainly made some improvements. There's a lot that needs to be done. And when I was at HIMSS a few weeks ago, interoperability is still the watchword. And the finger has been pointed to the large EHR vendors for making it difficult to share information across, the entire communities. And
EHR for electronic health record, just
Correct.
for our audience who may not be familiar with that term.
I think, Casey, also is, all these challenges that you're talking about, obviously, are going to create interesting needs around data governance. Could you sort of chat with us a bit about what you see as the big data governance requirements in healthcare at the moment?
Certainly. AHIM has been spending a lot of time over many years looking at data integrity, data governance, IT governance. And during our strategic planning sessions, probably a good 3 years ago, we decided that we really needed to look at a broader initiative than just data governance and really focusing on the clinical side of healthcare. So we really broadened the initiative, and now we're calling it information governance. And data governance is a piece of it, as well as IT governance. But we're really looking at all information that needs to be generated, preserved, collected, and then ultimately looking at the final disposition of that data stream. So whether it's clinical, financial, or operational, and wanting to make sure that there are rules, that there are protections around that type of data, and that it is controlled throughout the healthcare ecosystem.
What are AHIMA's top, say, 2 goals in the coming year, would you say?
The top 2 goals would be information governance, as well as all of our strategic initiatives around health informatics. And health informatics is the umbrella for all of the standards, interoperability, everything we're doing with ICD-10 transition, which is so necessary in order to have the granular data necessary to fuel these initiatives. Everything we're doing around even the terminology, certainly clinical documentation improvement is a big component within that area. Being able to do all of the the analytics, the making sure that EHRs are structured, and that the data integrity pieces are well spelled out. So those would be the 2. We have other pillars. And now one thing I want to make clear, that public good, which is a very important strategic pillar, and consumer engagement, that is woven into information governance as well as health informatics. And then also the leadership component is critical to these initiatives, wanting to make sure that our members feel comfortable in leading these initiatives and really, providing what's needed in order to, again, make sure that we have the right information at the right time for the right patient.
And Casey, one final question from me would be, what you see as the top priorities for your membership within, again, this sort of abbreviated time frame of the next year or so.
The top priority for our members are to make sure that they feel comfortable and confident in leading these very critical initiatives, and that they understand, how the dots are connected and why it's so important that they step up to the plate, lead, not follow. And there are a lot of challenges, but there's a lot of opportunities as well. And if we can't get it right one patient at a time, then we're not going to get the outcomes that we need, and we're not going to be able to improve patient care.
Moving on to governance questions, Ken. How does data quality play into your big data initiatives there at Sharp Healthcare?
Great question. We really are focusing on data governance, data definitions, data integrity and data quality. It's been a big area that we've begun to see some, I don't know if I'd say issues, but just some challenges with as we start to look at data from an enterprise perspective. Typically, the data has been collected and entered at an individual site, and as they do analysis for that site, the meaning is pretty consistent, but as you start to look across sites, you begin to see that. So we're really investing heavily in identifying data ownership, data integrity, and as we get into big data, I think the challenges are going to be just as significant there. Although we are looking at potentially doing kind of a tiered approach. So if we start with big data technology and we start doing some simple queries or some insights, we may concern ourselves less initially about the data quality, data validity till we start to see some areas we really want to focus on. Then we might begin then looking at validating the data, making sure the integrity is there, the quality, and then get it into kind of a more structured format. So there'll be a little bit of a multi-tiered approach. The things that we're making significant business decisions on, we want to make sure that we've really vetted the quality of the data. Those things where we're just trying to gain some initial insights and focus, we may not have the controls and notes that we do in the other areas.
Mm-hmm. Steve, any follow-up for Ken on the governance topic?
Yes, Ken. What about data security as an issue for you around your data governance, data management challenges there?
Yeah, it's a significant item that we're dealing with. As one of the aspects of putting in our data governance program is to kind of balance the need to increase people's access to the data, as well as trying to control, making sure people are not getting that data they shouldn't be. I think it's a constant struggle. Our job is to try to make information more available, but we have to be concerned about inappropriate access. And I think, as I said, even probably with the big data, we're probably going to have a little more or a little less control initially. As I said, we're not using it for business decisions. We're trying to see what insights we can gain. And then just like we're doing with the data quality, as we begin to look at how that data is really going to be used, and we start to implement the most appropriate controls on security and access. But it's a constant balance between making information available and also making sure you don't have inappropriate access.
We can't let you go without asking if you can share with us your, say, top 2 priorities for the coming year.
Okay. First is, I call it one of our big strategic priorities, and that's really looking at developing a digital strategy. When we talk about digital strategy, we're really talking about how do we engage our patients and consumers in a different way, in more of a retail environment, or look at it from, they're really participating in healthcare. We've traditionally done things very much from a process or production orientation. We really need to begin looking at engaging consumers and providing services in more real time in different settings. So we're working very hard to try and define what is that strategy around becoming more engaged in the digital world and competing with those non-traditional entries into the market, places like the Walmarts and the CVSs and that are looking at trying to capture individuals from a diagnostic and wellness platform. So that's one of the big areas we have from a strategy standpoint. And there's another more tactical priority that's really come on the scene in the last year, and that's how do we better support our health plan? Sharp has a health plan that's growing rather dramatically, and we really need to look at new tools and new systems to support the health plan, both in the back end and administrative process, simple things like enrollment, claims processing, but also again in the consumer engagement. They're moving very much from a broker provided insurance to individual insurance. So individuals are engaging in looking at options and selecting plans and helping in with issues. So we really have a lot of work to do in advancing and kind of leapfrogging our technology around the health plan as it continues to grow.
Hello, I'm Amy Hara, Vice President of Solutions and Delivery for Round World Solutions, the experts in integrated governance with project execution with a focus on big data solutions. Our unique 360-degree view enables us to give CXOs a comprehensive view of where they are today, where they would like to be, and delivers a powerful framework to encompass change management structures to ensure they accomplish their goals. ICCG Close-Up is an interview panel where Fortune 1000 CXOs share their views on big data, governance, and their most pressing issues. At the conclusion of the interviews, we'll be compiling the results into an industry and issue-specific report to share with all of the interviewees, emphasizing common interests and future plans associated with those interests across industries. The benefits to our participating CXOs are the creation of a virtual CXO interactive knowledge base, highly scaled shared resources, and the ability to learn from each other without having to reinvent the wheel. Thank you for watching ICCG's Close-Up, sponsored by Round World Solutions. For more information about our CXO interview panel or to join the conversation, please visit us at www.roundworldsolutions.com. Thank you.